I want you to imagine two vastly different rooms.
Okay.
In one, the air is really warm and it smells faintly of like crushed herbs.
Right, a very calming environment.
Exactly. And a practitioner spends, I don't know, 2 hours just asking you about your childhood,
Yeah.
the quality of your sleep, what you usually eat for breakfast.
Getting the whole picture.
Yeah. And then they gently tap a microscopic needle into your forearm. And the goal is to restore this 2,000-year-old concept of energy flow. It's very quiet, it's slow.
And it's completely focused on coaxing the body into long-term harmony.
Right, exactly. But now I want you to step into the other room. The fluorescent lights are just buzzing overhead. The air is freezing cold.
A total sensory shift.
A complete shift. A doctor shouts, "Clear!" and a machine blasts 200 joules of raw, man-made electricity directly into a dying man's chest.
Literally forcing his heart to reboot.
Yes. It is violent, it is instantaneous, and it is the absolute pinnacle of biological intervention.
It really is.
So today, we are exploring the extreme edges of human survival. We're taking everything we know about how we keep these complex, fragile, resilient human machines running.
And we're looking at the starkest contrast in modern healthcare.
Exactly. On one end, we have the deep, slow burn of holistic health. And on the exact opposite end, we have the adrenaline-pumping, break glass in case of emergency tools of a medical crash cart.
It's an incredible contrast.
It really is. So, welcome to the deep dive. I am pulling up a chair right next to you today because we have an incredibly wild journey ahead of us.
We really do.
Yep.
I mean, it is the ultimate juxtaposition. And I think to really grasp what human health is, you actually have to look at both of these extremes.
Right, you need the whole spectrum.
Yeah, because you can't fully appreciate the sheer terrifying force of a split-second chemical intervention to save a life without first understanding the intricate, decades-long lifestyle practices.
The practice is designed to prevent that emergency from ever happening in the first place.
Exactly. The human body exists on a continuum between those two rooms.
And that's exactly why we are pairing these two concepts today. So we're going to start in that warm, quiet room.
The slow burn.
Right. We're going to look at the philosophy and the actual physical mechanics of complementary and alternative medicine, or CM for short.
But we should probably clarify that term first.
We definitely should, because the word alternative gets thrown around a lot, and it usually carries this, I don't know, this rogue anti-establishment vibe.
Yeah, people think it means rejecting science.
Exactly. But when you actually look at how these practices are defined in the source material, it's not a rejection of modern science at all.
No, not at all.
It's explicitly designed to be used alongside conventional medicine. I mean, it's right there in the first word. Complementary.
It's an important distinction to make because the popular narrative often forces a false choice.
Like it has to be one or the other.
Right. People think you either have to live in the forest and eat moss, or you have to subject yourself to a sterile hospital bed hooked up to 12 monitors.
That is such a funny image, but it's true.
But the actual framework of CAM is integrative. I mean, the idea is to recognize what conventional Western medicine does spectacularly well.
Which is usually like acute trauma.
Yeah, acute trauma, aggressive infections, surgical interventions, and then combine that with systems that might be better suited for managing chronic issues.
Things like chronic pain, long-term stress, or generalized fatigue.
Exactly. Conventional medicine is fantastic if you shatter your femur.
Absolutely. Give me the conventional hospital for a shattered leg.
Right. But it's sometimes less effective if you just feel inexplicably exhausted and achy for 5 years straight.
That makes a lot of sense. So the core philosophy here is treating the whole person. And that sounds like a great buzzword.
It does get overused.
It really does. But how does it actually contrast with the standard model? Like, if I go to my regular doctor versus a holistic practitioner, what is the fundamental difference in how they're looking at me?
Well, historically, the conventional medical model compartmentalizes the body. It views the human organism as a collection of separate, highly specialized mechanical systems.
Right. So you have a specialist for everything.
Exactly. You have a cardiologist for the pump, a nephrologist for the filters, a dermatologist for the casing.
Casing, I love that.
So if you develop a mysterious rash, you go to the skin doctor and they look at the skin.
Just the skin.
Right. And they might prescribe a topical steroid to suppress that localized inflammation. But the CAM approach, however, refuses to separate that rash from the ecosystem in which it exists.
Okay, so how do they look at the rash?
A holistic practitioner looks at the rash and asks, what is the patient's baseline cortisol level? Are they digesting their food properly? Are they experiencing a prolonged period of grief?
Wow, grief causing a rash.
Yeah, because it views the rash not as an isolated skin disease, but as a surface-level alarm bell, indicating a deeper systemic imbalance.
Okay, let me try an analogy here to see if I've got this. The traditional model feels a bit like taking your car to a mechanic because the check engine light came on,
Okay, I'm following.
and the mechanic hooks it up to a computer, finds out the O2 sensor is bad, replaces the sensor, turns off the light, and you drive away.
Very localized and reactive.
Right. It is incredibly effective, but it's reactive. The CAM approach feels more like the actual daily ownership of the car.
Ah, right. The maintenance.
Yeah, it's choosing the premium fuel, it's checking the tire pressure when the weather changes, it's noticing that the engine sounds just a tiny bit sluggish on Tuesday mornings, and adjusting how you drive.
It's the proactive cultivation of the machine's environment.
Exactly. Cultivating it so the check engine light never actually comes on in the first place.
That's a fair way to conceptualize it.
Yeah.
But I'd say it's even a bit more complex than that. Because, a car doesn't have the ability to fix its own engine block.
That is a very fair point.
The defining characteristic of CAM is this profound, almost reverent trust in the human body's innate autocorrection mechanisms.
So it assumes the body knows what to do.
The assumption is always that the body wants to be healthy. And if it's sick, there is a physical, energetic, or emotional block preventing that natural healing state.
But this is where I start to get a little skeptical, I have to admit.
That's completely understandable.
Because conceptual harmony and holistic ecosystems, they sound beautiful in theory. But if I walk into a clinic tomorrow complaining of a torn rotator cuff or severe migraines, what are they actually doing to my body?
Right, you want to know the tangible actions.
Yeah, we aren't just talking about burning sage and having a nice check.
Right.
What are the physical interventions?
Right, let's ground this in the physical modalities. When you look at the established practices under the CAM umbrella, they are highly tactile. Let's take acupuncture, for instance.
Okay, so acupuncture is literally inserting tiny, thin needles into specific points on the body. And the goal is pain relief and healing. But how on earth does stabbing someone with a needle fix a migraine? It feels counterintuitive.
Well, the classical 2,000-year-old explanation is that the body contains a life force or energy called qi.
Right, I've heard of qi.
And this qi flows along specific pathways called meridians. When you are sick or in pain, that flow is blocked, like a dam in a river.
So the needles break the dam.
Yeah, that's the classical idea. The needles are placed at specific intersections to restore the flow. Now, from a modern Western physiological perspective, we obviously aren't mapping invisible energy rivers.
Right, science needs something it can measure.
Exactly. But what we actually can measure is absolutely fascinating.
Okay, so what is the Western translation of a meridian line?
It boils down to neuroanatomy and microtrauma. When you insert a needle into the skin, you are creating a tiny, localized injury.
A micro.
Right. And the body's immune system immediately responds to that microtrauma by increasing blood flow to the area. But more importantly, inserting these needles into specific nerve-rich areas triggers a cascade in the central nervous system.
Oh, wow. So it's messing with the nervous system directly?
It stimulates the release of endogenous opioids, the body's natural painkillers, like endorphins. Furthermore, recent studies suggest that acupuncture actually stimulates the release of a chemical called adenosine at the site of the needle.
Wait, adenosine?
Yes, which acts as a powerful local pain reliever.
Okay, keep a pin in that name, adenosine, because I know that comes up again when we get to the crash cart. But in a wildly different context.
It definitely does. It's a fascinating chemical.
That's incredible. So it's essentially a mechanical hack to force the brain's pharmacy to dispense painkillers.
That is a great way to phrase it, yes. And it relies on something called the gate control theory of pain.
What is that?
Imagine the spinal cord has neurological gates that either allow or block pain signals from reaching the brain.
Okay, I'm picturing little toll booths.
Right. And the physical sensation of the needle being manipulated
Yeah.
can actually overload those sensory pathways. It effectively shuts the gate on the deeper chronic pain signals like your migraine or your backache.
Okay, that makes so much more sense than just unlocking energy. And it seems like a similar mechanism might be at play with massage and reflexology.
They definitely share some principles.
Like massage manipulates the soft tissue, I get that. But reflexology is the one that really trips me up.
It's a tough one for a lot of people to accept.
Yeah, because applying pressure to a specific patch of skin on your hand or foot to somehow treat your liver, that just feels like a massive stretch.
It is definitely one of the more fiercely debated modalities in terms of its anatomical logic.
I can imagine.
Reflexology operates on the premise that the entire body is mapped out on the hands and feet. So applying pressure to the base of your thumb might correspond to your stomach.
But there's no actual nerve going from the thumb to the stomach, right?
Exactly. Conventional anatomists will tell you there is no direct neural pathway that connects the skin of your thumb exclusively to your stomach lining.
Right. So why does anyone do it? Why is it codified as a recognized alternative therapy in our sources?
Because of the profound systemic effects of localized pressure. Even if the direct thumb-to-stomach wire doesn't exist, our hands and feet are the most nerve-dense areas of our bodies.
Well, yeah, they are how we interact with the world.
Exactly. When a practitioner applies deep, sustained, rhythmic pressure to those nerve endings, it triggers a massive parasympathetic nervous system response.
Oh, the parasympathetic nervous system, that's the rest and digest state,
Yes,
right?
exactly. It actively suppresses the sympathetic nervous system, which is your fight-or-flight adrenaline response.
So it turns off the panic mode.
Right. So while massaging a specific point on the foot might not mechanically fix a diseased liver, the profound lowering of cortisol, the drop in heart rate, and the vasodilation that occurs during the session creates an internal environment where the body's own immune system can function at its absolute peak.
Wow, you are basically removing the stress barrier to healing.
Okay, so with acupuncture, massage, and reflexology, we are talking about mechanical, physical manipulation.
Very hands-on.
But there's another category here in our source notes that moves away from the mechanical and into what feels like unconventional biophysics: magnet therapy and homeopathy.
Yes, these are where the debates get really intense.
Let's start with magnets,
Good.
because I see people wearing those magnetic bracelets all the time.
Magnet therapy is fascinating because it sits right on the edge of what we understand about cellular biology. The premise is that human tissue, blood, and bones naturally contain electromagnetic properties.
Which is true, right?
It is. Everything from the iron in our hemoglobin to the electrical impulses firing in our brains relies on electromagnetic properties. Practitioners use static magnets, often worn as bracelets or applied to injuries, with the belief that external magnetic fields can interact with our internal magnetic fields.
But does a wearable magnet actually do anything, or is it just the placebo effect of wearing a medical-looking device? Well, the clinical data is highly mixed. But the theoretical mechanism proposes that a magnetic field might alter the behavior of ion channels in our cells.
On channels.
Yeah, your cells use ions like calcium and potassium to communicate. If an external magnetic field could slightly alter how those channels open and close, it could theoretically change how a cell signals inflammation or pain.
Oh, that's interesting.
Some proponents also suggest it alters blood flow by interacting with the iron in red blood cells. Though physicists will quickly point out that the iron in our blood is not ferromagnetic in the way a refrigerator magnet is.
Right, you don't stick to your fridge when you walk by it.
Exactly.
So the jury is definitely still out on the physics there. But if magnet therapy is a gray area, homeopathy is completely mind-bending.
It really challenges our modern understanding of medicine.
It does. This is the concept of using highly diluted substances to trigger healing. I've tried to wrap my head around this, and it sounds completely backward. From what I understand from the sources, you are taking the exact thing that causes the illness and using it as the cure.
It completely defies the modern pharmacological mind. Homeopathy was developed in the late 1700s by a German physician named Samuel Hahnemann.
Okay.
The central doctrine is similia similibus curantur, which translates to like cures like. Hahnemann believed that a substance that causes symptoms of a disease in healthy people would cure similar symptoms in sick people.
So if I have a fever and hot flashes, a homeopath might give me a microscopic dose of belladonna, which is a toxic plant that causes fever on hot flashes.
Yes, but the key word there is microscopic. The second core tenet of homeopathy is the law of infinitesimals.
The law of infinitesimal.
Right. Hahnemann believed that the more you dilute a substance, the more potent it becomes. And the dilution process is extreme. They take one part of the active ingredient, mix it with 99 parts of water or alcohol, and vigorously shake it.
Shaking it is important.
Yes, it's a process called succussion. Then they take one part of that mixture and dilute it in 99 parts of water again.
And they just keep doing that.
They do it dozens, sometimes hundreds of times. To put this in perspective, many homeopathic remedies are diluted past something called Avogadro's limit.
What is Avogadro's limit?
That is the point in chemistry where the dilution is so extreme that statistically, not a single molecule of the original active substance remains in the final liquid. You are left with pure water or pure alcohol.
Wait, hold on. Not a single molecule. None.
Statistically zero.
And what are you actually taking? How could that possibly interact with the body?
The homeopathic explanation is that the vigorous shaking process leaves an energetic imprint or a memory of the original substance in the water molecules.
Water memory.
Yes. The water remembers the shape or the energy of the toxin, and that memory is what triggers the body's vital force to heal itself.
Okay, I have to be honest here. Water memory sounds like absolute magic, not medicine. I mean, we're just reporting what the sources say, but that's a tough pill to swallow, pun intended.
And the overwhelming majority of the conventional scientific community agrees with you. There is no known law of physics or chemistry that supports water memory.
Right.
When homeopathy is tested in rigorous double-blind clinical trials, it consistently performs no better than a placebo.
So why is it still such a massive multi-billion-dollar global industry? Why do people swear by it if it's statistically just water?
Because we severely underestimate the physiological power, the therapeutic ritual, and the sheer force of the placebo effect.
Placebo effect. Right.
The placebo effect isn't just faking it. It is a highly complex neurobiological event. When a patient sits with a homeopath for an hour, feels heard, feels cared for, and is handed a remedy with the absolute assurance that it will help,
The brain starts working.
the patient's brain responds. It releases dopamine. It alters pain perception. The mind commands the body to begin healing because it believes the intervention has occurred.
Wow. Which perfectly bridges us into the next core concept of holistic health, the mind-body connection.
It's a huge part of CAM.
It really is. If the mind can literally generate a physical healing response from a sugar pill or pure water, what else can it do? I was looking at the recognized practices here in the notes, and I actually laughed out loud when I saw that humor is officially codified as a medical intervention.
Humor therapy, yeah.
Using laughter to improve physical health. That is amazing.
It sounds frivolous, but the science behind it, a field actually called gelotology, the study of laughter,
Yeah?
is rock solid. A deep, genuine laugh is a violent, highly coordinated physiological event.
A violent physiological event. I love that description of a chuckle. What is actually happening in the body?
When you experience a belly laugh, your diaphragm spasms. You are taking in massive, rapid gulps of oxygen-rich air, which stimulates your heart and lungs.
It was almost like a workout.
It forces a surge of blood flow through the vascular system. But the real magic happens in the brain. Laughter triggers a massive dump of endorphins, the body's natural opiates, which instantly elevate pain thresholds.
And what about stress?
Simultaneously, it drastically drops the levels of cortisol and epinephrine in your bloodstream.
So it turns off the stress response entirely.
Exactly. It is almost impossible for your autonomic nervous system to remain in a state of high alert panic while you are genuinely laughing.
That makes sense. You can't be terrified and laughing at the same time.
Evolutionarily, laughter is a social signal that the environment is safe. When you laugh, you are literally telling your cellular biology, the threat is gone. You can repair now.
That is incredible. And this idea of the mind dictating the physical reality extends to things like faith and visualization, too.
Yes, spiritual and psychological healing.
The literature talks about guided imagery, where you use mental images to promote healing. How does that work?
This falls under the umbrella of psychoneuroimmunology, which is the study of how the brain, the nervous system, and the immune system communicate.
Okay.
We used to think the immune system was completely autonomous, but we now know that nerve endings actually terminate directly in the lymph nodes and the spleen. Your brain is hardwired into your immune system.
So if I sit and close my eyes and vividly visualize a calm beach, or even visualize my white blood cells attacking a tumor, what is the physiological translation of that thought?
By consciously shifting your focus away from fear and pain, you suppress the HPA axis,
The HPY axis.
the hypothalamus pituitary adrenal axis. This stops the adrenal glands from pumping out stress hormones. And when stress hormones drop, immune cells like natural killer cells and T cells actually become more active and aggressive.
Oh, wow. So calming the mind unleashes the immune system.
Exactly. The visualization is the software code that reprograms the hardware's output.
But here's the thing. Visualization requires a lot of trust. You can't see your T cells working. But there's a practice that actually bridges that gap, providing hard proof of the mind-body connection.
Biofeedback.
Yes, biofeedback. This is where the holistic philosophy meets cold, hard data.
Biofeedback is a revelation for people who are skeptical of the mind-body connection. It takes the invisible autonomic nervous system, the things you think you can't control, like your heart rate, your blood pressure, your skin temperature, and makes it visible.
Walk me through what a session actually looks like for the listener.
Well, you sit in a chair, and a practitioner attaches painless sensors to your skin. These sensors measure things like heart rate variability, muscle tension, or sweat gland activity.
Okay.
That data is fed into a computer and displayed on a monitor right in front of you. It might look like a line graph or even a video game where a car drives faster when you're stressed.
Okay, so I am staring at a live feed of my own nervous system.
Right, and at first, if you're anxious, your heart rate is high, your muscle tension is off the charts. The practitioner then guides you through a breathing exercise,
Like deep breathing.
maybe inhaling for 4 seconds, exhaling for 6 seconds. And as you do this, you literally watch the line on the screen drop. You watch your heart rate slow down. You see the muscle tension melt away.
So you are watching your thoughts change your biology in real time.
It's operant conditioning for your internal organs.
Yeah.
You learn, through immediate visual reward, what it physically feels like to dilate your blood vessels or slow your SA note.
And then you can just do it on your own.
Once you learn that feeling, you can recreate it at home without the machine. You take the steering wheel of the car you previously thought drove itself.
That is wildly empowering. And it really segues perfectly into the grand comprehensive systems of CAM.
The full lifestyle systems.
Yeah. These are practices where the mind-body connection isn't just a 1-hour clinical session. It's an entire architecture for living. Things like yoga and Tai Chi.
Movement therapies.
Right, they are movement therapies, but the sources define them as combining physical postures, deep breathing, and meditation.
They're essentially moving forms of biofeedback. In yoga, you are taking the physical body and placing it under a minor controlled physical stress, like holding a difficult pose that requires strength and balance.
Like a plank or downward dog.
Right. Your sympathetic nervous system wants to panic, speed up your heart rate, and tense your muscles to escape the stress. But you are simultaneously using the deep, controlled breathing to force the parasympathetic nervous system to remain calm.
You are training yourself to be relaxed in the middle of a struggle.
Exactly. You are increasing your vagal tone. You are teaching your nervous system that it does not have to freak out every time life gets uncomfortable.
And Tai Chi.
Tai Chi does the same thing through martial arts forms, utilizing slow, deliberate, flowing movements that require intense mental focus and proprioception, which is the awareness of where your body is in space.
And we also see naturopathy and aromatherapy listed as comprehensive approaches in the notes. Naturopathy is all about natural remedies and supporting the body's innate healing wisdom.
Using nature as medicine.
But aromatherapy, I have to ask about this. Sniffing lavender to lower my blood pressure. How does the scent of a plant actually change my cardiovascular system? It feels a little, out there.
It's all about the olfactory bulb. Your sense of smell is uniquely wired in the human brain.
How so?
Unlike your sense of sight or hearing, which have to be processed through the thalamus first, your olfactory bulb has a direct, unmediated neural connection to the limbic system.
The limbic system, that's the emotional center of the brain.
Specifically the amygdala and the hippocampus, which govern emotion, fear, and memory. When you inhale the volatile organic compounds of an essential oil like lavender, those chemical molecules bind to receptors in your nose,
Okay.
and they send an immediate electrical signal straight into the limbic system. Studies have shown that the compounds in lavender actually interact with the neurotransmitter GABA to quiet the brain and nervous system.
Wow.
It physically reduces agitation and heart rate before you even consciously register that you are smelling a flower.
The biology of that is just stunning. But out of all these comprehensive systems, there is one that seems to be the ultimate manifestation of this whole person philosophy, and that is Ayurvedic medicine.
Oh, absolutely. Ayurveda translates roughly to the science of life. It originated in India over 3,000 years ago, and it is arguably the most ambitious, encompassing medical framework ever devised.
It sounds huge.
It makes a regular physical exam look like a quick glance in the mirror.
Because it's not just about what herbs to take, right? It's an entire lifestyle matrix.
It leaves no stone unturned. Ayurveda categorizes human beings into 3 primary mind-body types, or doshas: Vata, Pitta, and Kapha.
What do these doshas mean?
These doshas reflect different combinations of elements and dictate your physical build, your digestion, your emotional tendencies, and even what diseases you are prone to.
So it's highly personalized.
Extremely. An Ayurvedic practitioner doesn't just want to know where it hurts. They want to know what time you wake up, what season it is, whether you prefer hot or cold food, and how you process anger.
So the treatment is wildly customized.
Deeply customized. If you have digestive issues, the conventional model might just give you an antacid. Ayurveda will look at your dosha, prescribe a specific diet of warming spices to stoke your digestive fire, assign specific yoga postures to stimulate the gut, and dictate exactly what time of day you should be eating your largest meal to align with your body's circadian rhythms.
That is incredibly comprehensive.
It is an acknowledgement that your body is a reflection of your daily habits, your environment, and your mind.
Okay, so if we take a step back and look at this entire holistic landscape, from the micro trauma of acupuncture needles to the direct neural pathways of a belly laugh to the massive lifestyle architecture of Ayurveda, it paints this beautiful, cohesive narrative.
It really does.
It's the slow burn. It's about building a fortress of health, brick by daily brick, and trusting that the body, if given the right environment, has a miraculous ability to heal itself.
It is the ideal state of human existence. It is the garden perfectly tended.
But, and here's the friction. Here is the uncomfortable, brutal reality of biology that we have to confront today.
The turning point.
What happens when the garden catches fire?
Yeah.
What happens when you've done your yoga, you've eaten your perfectly spiced Ayurvedic meals, you've maintained your vagal tone, but a microscopic blood clot snaps off a vein in your leg, travels up into your lungs, and violently blocks the pulmonary artery.
Holistic medicine can't fix that in real time.
Or a bee stings you, and your immune system makes a catastrophic error, swelling your airway completely shut in less than 60 seconds.
That is the threshold. That is where all the deep breathing in the world cannot save you. That is where the sunlit room goes instantly dark.
Listeners, I want you to imagine that visual shift right now. The warm room, the botanical charts, the scent of lavender, they vanish.
Gone.
You are now standing in a stark, brightly lit, tiled emergency room. The fluorescent lights hum with this anxious, vibrating energy. The air is deliberately cold.
It's a completely different world.
And sitting right in the center of the room is a metal cart. It's painted bright red. It has 5 drawers, a defibrillator mounted on top, and an oxygen tank strapped to the side. We are pivoting to the second half of our deep dive, the medical crash cart.
We have crossed the event horizon. We are no longer in the realm of the whole person. We are in the terrifying, hyper-focused realm of failing organ systems.
All the holistic stuff is out the window.
Completely. The philosophy of slow, gentle coaxing is out the window.
Yeah.
We are now talking about absolute, immediate, brute force crisis intervention.
The first thing you realize when you look at the source notes and the protocols for a crash cart is that it isn't just a toolbox. The physical cart itself is governed by incredibly strict rules.
The rule of the cart.
Yeah. The protocols state it must be kept in a specific, universally known place in an ambulatory setting. It must be meticulously organized, and that organization must be standardized. Why is that so crucial?
This is a critical point regarding human psychology under extreme stress. When a patient codes, when their heart stops or they stop breathing, the medical team experiences a massive adrenaline spike.
Even the doctors panic.
It's biological. In that state of panic, cognitive function narrows. You lose the ability to perform complex searches or read fine print. The rule of the cart exists to remove cognitive load.
So they don't have to think.
Exactly. If a doctor yells for epinephrine, the nurse doesn't have to think. Muscle memory knows that epinephrine is always in drawer number 2, front left corner.
The protocols also demand regular, almost obsessive review of the cart's contents for expiration dates and rigorous training for the staff on how to access it.
Because you are racing a biological clock that gives zero margin for error.
How fast is that clock?
When a heart stops pumping blood, the brain is deprived of oxygen. You have roughly 4 to 6 minutes before irreversible hypoxic brain damage begins.
4 to 6 minutes, that is nothing.
By the 10-minute mark, without intervention, the chances of meaningful neurological survival drop to near zero. You do not have time to look for the key to the cart. You do not have time to realize the medication expired a month ago.
So let's look at the actual hardware survival mounted on this cart. The foundation of the crash cart is 3 physical tools: the defibrillator, the oxygen tank, and the ambu bag.
Electricity, oxygen, and pressure.
Electricity, oxygen, and pressure. I love that. Let's start with the defibrillator, because we've all seen it dramatized a million times on television, right?
Absolutely, the classic hospital scene.
The monitor flatlines, a long continuous beep plays, the handsome doctor rubs the paddles together, yells, "Clear!" shocks the patient, and the heart magically starts beating again.
Hollywood has done a massive disservice to the public understanding of defibrillation.
Really? How so?
First of all, if a patient is flatlining a state called a systole, where there is zero electrical activity in the heart, you do not shock them.
Wait, really? You don't shock a flatline?
Never. A defibrillator cannot restart a completely dead, silent heart.
Okay, my mind is blown. You've explained the mechanics of that. If it doesn't start the heart, what is it doing? Why are we using it?
Because a defibrillator doesn't start the heart. It stops it.
It stops it. Why are we trying to stop a heart that is already failing? That sounds like the opposite of what you want to do.
We use a defibrillator for specific chaotic arrhythmias, the most common being ventricular fibrillation, or VFib.
What is VFib?
Imagine the heart muscle is a beautifully coordinated rowing team. The electrical signal from the sinus node tells everyone to row at exactly the same time. The heart squeezes, blood moves.
Okay, makes sense.
In VFib, the electrical system goes insane. Every single muscle fiber in the ventricles decides to fire randomly on its own. The heart isn't pumping. It looks like a bag of writhing worms.
Oh, that's a horrible image.
It's quivering, expending massive energy, but moving absolute zero blood.
So it's electrical anarchy.
Exactly. What the defibrillator does is deliver a massive blunt force wave of electrical energy, up to 360 joules straight through the chest wall and across the myocardium.
And what does that do to the anarchy?
That blast depolarizes every single cardiac cell simultaneously. It is an electrical sledgehammer that forces all the chaotic signals into complete silence.
So it flatlines them on purpose.
Yes.
Yeah.
It flatlines the heart for a fraction of a second. The hope is that by turning everything completely off, the heart's natural primary pacemaker will seize the silence, take control, and start the rhythmic rowing beat again.
That is wild. So it literally is a hard computer reboot. You're holding the power button down until the screen goes black, praying the operating system loads properly when it boots back up.
It is the ultimate system override.
And that concept of an override brings us to the respiratory tools on the cart, the oxygen tank and the ambu bag. The ambu bag is that compressible, self-inflating plastic bulb with a face mask attached, right?
Yes, known clinically as a bag valve mask.
Right. And when we look at this tool, I want to highlight the stark philosophical contrast we've hit. In the first half of this deep dive, we talk about naturopathy trusting the body's natural processes. We talked about yoga training the breath.
The ambu bag is the antithesis of that.
Exactly. When a patient is in respiratory arrest, you place that mask over their nose and mouth, you connect it to pure oxygen, and you physically squeeze the bag to force air down their trachea and inflate their alveoli.
Because normal human breathing is negative pressure. Your diaphragm drops, creating a vacuum in your chest, and air gets sucked in. It's a gentle, natural mechanism.
And the ambu bag is different.
The ambu bag is positive pressure ventilation. You are violently shoving air into a closed space. You are not supporting the body's natural breath. You have usurped the role of the lungs.
You are doing the breathing for a piece of machinery that has completely failed.
Exactly. You are taking manual control.
It is heavy to think about. But the mechanical interventions are just the beginning. Let's open the drawers of this cart. Let's dive into the pharmacology of survival. Our source material lists the terrifyingly precise arsenal of emergency medications.
This is where we move from mechanical overrides to chemical warfare.
Chemical warfare. Let's start with managing a cardiac crisis. A patient comes in clutching their chest, pale, sweating. The immediate fear is a myocardial infarction, a heart attack.
Right, a true emergency.
The crash cart protocol dictates 2 immediate drugs, aspirin and nitroglycerin. Let's break those down. Why are we giving them aspirin? I take aspirin for a headache.
Well, time is muscle. When a heart attack happens, a plaque inside a coronary artery has ruptured. The body's immune system panics, thinks you are bleeding to death internally, and sends millions of platelets to the site to form a blood clot.
But there's no bleeding.
Exactly. That clot completely blocks the artery, starving the heart muscle of oxygen.
So what does the aspirin do?
Aspirin is an antiplatelet agent. At a cellular level, it permanently binds to an enzyme in the platelets, preventing them from producing a chemical called thromboxane A2.
And without that chemical?
Without that chemical, the platelets lose their stickiness. They cannot clump together. So chewing an aspirin immediately halts the growth of the clot, preventing the blockade from getting any worse.
Wow. And then you administer nitroglycerin. What does that do?
Nitroglycerin is a potent vasodilator. When it enters the bloodstream, it converts to nitric oxide. This chemical violently forces the smooth muscles lining the blood vessels to relax. The veins and arteries rapidly expand.
So it opens up the pipes?
Exactly. This drops the blood pressure, reducing the workload on the struggling heart, and widens the collateral blood vessels around the blockage, desperately trying to route oxygen-rich blood to the dying tissue.
And that's why patients feel an immediate relief of that crushing chest pain.
It is. It's temporary, but it buys time.
It is so specific. But the next two drugs on our list present a duality that I find absolutely fascinating. These are for when the heart's rhythm is intact, but the speed is completely lethal.
Right. Rate control.
We have adenosine for tachycardia, which is a rapid heart rate, and atropine for bradycardia, a slow heart rate.
This is where the sheer precision of the crash cart shines. In the holistic model, we treated the entire ecosystem to slowly lower the resting heart rate. Here we are looking at a jagged line on a monitor, making a split-second diagnosis of a mechanical failure and deploying a hyper-targeted chemical missile.
Let's talk about adenosine first, because you mentioned this during the acupuncture section, but this is the drug I want to use my new analogy on.
Let's hear it.
Let's say a patient's heart is beating at 200 beats per minute. Supraventricular tachycardia. The electrical signal is caught in a loop, spinning out of control. The heart's beating so fast it literally doesn't have time to fill with blood before the next squeeze.
It's a useless, quivering flutter. Blood pressure plummets.
So if the heart's electrical system is a highway, and the electrical signals are cars speeding out of control, adenosine isn't a brake pedal, it's a police spike strip.
That is highly accurate. When you push adenosine into an IV, it rushes to the AV node, the electrical relay station between the top and bottom chambers of the heart. It binds to specific purinergic receptors, and it physically halts all electrical conduction.
It slams the gate shut.
It slams it shut.
And what does that actually look like on the monitor?
The rapid, frantic zigzags instantly turn into a flat line. The patient's heart completely stops beating for anywhere from 3 to 10 agonizing seconds.
10 seconds of a flat line.
Yes. For the patient, it causes a profound, terrifying sensation of impending doom. It feels like they are dying because momentarily they are.
That is horrifying.
It's terrifying for everyone in the room. But then the adenosine washes out of the receptors, the spike strip is cleared, and the hope is that the sinus node wakes up and starts firing a normal, steady 70 beats per minute.
Okay, now what about the exact opposite problem? The heart rate drops to a sluggish 30 beats per minute. The brain is starving for oxygen. What do we use?
You deploy atropine.
Atropine, how does that work?
The heart rate is partially controlled by the vagus nerve, which acts as the brake pedal, releasing acetylcholine to slow things down. Atropine is a parasympathetic drug.
Meaning?
It rushes in and physically blocks the acetylcholine receptors on the heart muscle. It completely severs the vagus nerve's ability to communicate with the heart.
So you are effectively cutting the brake line.
Exactly. You cut the brake line, allowing the heart's natural automaticity to speed back up to a survivable rate.
The mechanics are just astounding. And we also have amiodarone on this list, which the protocols reserve for life-threatening arrhythmias.
Yes. If the defibrillator shock fails to keep the heart in a normal rhythm and the patient keeps slipping back into VFib, you use amiodarone.
What does that do?
It is a complex, heavy-hitting drug that blocks potassium, calcium, and sodium channels in the cardiac cells. It dramatically prolongs the action potential, meaning it forces the irritable, twitchy heart muscle cells to take a much longer rest between beats, stabilizing the chaotic electrical tissue.
It is a chemical straitjacket for the heart.
That's a great way to put it.
Now let's move past the cardiac drugs into section 7 of our sources, the systemic resets. Because the crash cart doesn't just deal with the heart. It deals with massive metabolic and respiratory collapses. And the undisputed king of the crash cart, the most famous drug in the drawer, is epinephrine.
Pure adrenaline.
The protocols mandate this for severe allergic reactions or anaphylaxis. Walk me through the cascade of anaphylactic shock. What is actually happening when someone eats a peanut and their body tries to die?
It is a catastrophic overreaction of the immune system. The body mistakenly identifies a harmless peanut protein as a lethal invader. It triggers mast cells to release a massive tidal wave of histamine and other inflammatory chemicals into the blood.
And what does that histamine do that makes it so dangerous?
It does two deadly things simultaneously. First, It causes massive vasodilation. All the blood vessels in your body suddenly relax and become leaky. Fluid rushes out of the veins into the surrounding tissue.
So blood pressure crashes.
This causes a catastrophic drop in blood pressure. There is no longer enough pressure to push blood up to your brain. You go into shock.
And the second thing?
It causes the smooth muscles lining your bronchioles, the airways in your lungs, to violently constrict and swell shut.
So you have no blood pressure and you cannot pull air into your lungs.
You are suffocating on dry land.
That is an absolute nightmare. So how does epinephrine fix a systemic collapse like that?
Epinephrine is the ultimate brute force systemic override. It binds to alpha-1 adrenergic receptors on the blood vessels, forcing them to violently constrict.
Which fixes the blood pressure.
Exactly. This instantly spikes the blood pressure back up to survivable levels, restoring blood flow to the brain. Simultaneously, it binds to beta-2 adrenergic receptors in the lungs.
And that fixes the breathing.
Yes, forcing those spasming airway muscles to relax, ripping the airway back open.
It combats the exact two ways the body is trying to kill you.
In a matter of seconds, you can have a patient blue and unresponsive, push an ampule of epinephrine, and 30 seconds later they are awake, gasping for air with a racing heart. It is the closest thing to magic in modern medicine.
The power of that is staggering. Now, the cart also contains drugs for metabolic crises. We have magnesium sulfate, which the literature says is used for severe asthma attacks or eclampsia in pregnant women.
Right. It acts as a powerful, smooth muscle relaxant.
We also have dextrose, which is essentially a massive, highly concentrated dose of sugar pushed directly into a vein when a diabetic patient's blood sugar has crashed so low they are comatose.
The brain runs exclusively on glucose. If the blood sugar drops too low, the brain literally turns off to conserve energy. Pushing an amp of dextrose is like plugging a dead laptop into a wall outlet. The brain powers back up almost immediately.
And calcium gluconate, used to stabilize the heart muscle when there is a dangerous imbalance of potassium in the blood, hyperkalemia, which could easily trigger a fatal arrhythmia.
It is all chemical warfare against a failing system.
It is. But the final category of drugs in the crash cart represents an entirely different kind of chemical warfare, and it might be the most fascinating mechanism in pharmacology.
I think I know where you're going.
Yes, the antidotes, the absolute undo buttons of medicine. The protocols highlight two specific medications: naloxone, used to reverse opioid overdoses, and flumazenil, used for benzodiazepine overdoses. Let's talk about naloxone, widely known as Narcan.
The concept of the competitive antagonist.
Explain that. What is happening in an opioid overdose, and how does naloxone reverse it?
When a person takes a massive dose of an opioid like heroin, fentanyl, or oxycodone, those opioid molecules travel to the brain and physically bind to specific docking stations called mu-opioid receptors.
Okay, docking stations.
These receptors are located in the brainstem, which is the primitive part of the brain that controls your automatic drive to breathe.
So the opioid binds to the receptor and tells the brainstem, hey, we don't need to breathe anymore.
Exactly. It suppresses the respiratory drive. The patient goes unconscious, their breathing slows down to 2 breaths a minute, and then it stops entirely. They die of hypoxia.
So how does naloxone fit in?
Naloxone is a miracle of chemical engineering. It is shaped almost exactly like an opioid molecule, so it perfectly fits into those exact same mu-opioid receptors. But crucially, it has a much, much higher affinity for the receptor than the opioid does.
Meaning it wants the seat more.
It wants the seat more, and it is stronger. When you spray naloxone up the nose or inject it into a vein, it rushes to the brainstem. It plays a violent game of chemical musical chairs.
Chemical musical chairs, I like that.
It physically knocks the opioid molecules off the receptors, kicks them back into the bloodstream, and binds itself to the docking station instead.
But because it's naloxone, it doesn't send the signal to stop breathing.
Correct. It is an antagonist. It blocks the receptor without activating it. The heavy, wet blanket of the opioid is suddenly ripped away from the brainstem.
And the brain realizes what's going on.
The central nervous system wakes up in a sheer panic, realizing it is starving for oxygen, and the patient suddenly gasps for air.
It is an instantaneous reversal of a dying process.
It is, but it is not a gentle awakening. Because you have instantly ripped every opioid molecule off the receptors, the patient is thrown into immediate, violent, precipitated withdrawal. They wake up agitated, in pain, often vomiting. It is chaotic and brutal, but they are breathing.
Wow. And flumazenil.
Flumazenil works in a nearly identical principle for benzodiazepines drugs like Valium or Xanax. It races to the GABA receptors in the brain, physically evicts the sedative molecules, and wakes the patient up from a chemical coma.
Wow. Okay, I want to take a breath and just look at the philosophical distance we have traveled in the last hour. Think about where we started.
It's a huge distance.
We started talking about homeopathy, the delicate, controversial belief that taking a microscopic, hyper-diluted, invisible energetic imprint of a substance can gently whisper to your body's vital force, nudging it towards self-healing over the course of months.
The ultimate expression of medical subtlety.
And we are ending with naloxone, a highly concentrated, engineered chemical designed to brutally and violently kick another chemical off a microscopic brain receptor in a span of 30 seconds to force a dying person to take a breath.
Two completely different worlds.
And the wildest part to me is that both of these modalities apply to the exact same human body.
It is the grand synthesis of what we are as a species. We are incredibly delicate ecosystems. We are profoundly influenced by the scent of a flower, by the depth of a laugh, by the emotional tenor of our relationships.
Right. Our minds can literally command our white blood cells through visualization.
Exactly. We require subtle, holistic maintenance. But we cannot deny our mechanics. We are also biological machines made of plumbing, electrical wires, and chemical receptors, and those mechanical systems are prone to catastrophic, sudden failure.
And for you, listening right now, wherever you are, I really hope this deep dive provided a profound appreciation for that entire spectrum. We aren't just one thing. We aren't just spiritual energy requiring alignment, and we aren't just fleshy cars requiring a mechanic with a wrench.
We are both.
We are both. We are the garden and we are the machine.
And that leads me to a final thought I want to leave you with today. A question to mull over as you go about the rest of your day, as you look at your own health and how you navigate the world.
Hit us with it. What's the question?
Think about the foundational goals of these two extremes. CAM relies entirely on the body's natural ability to heal itself, focusing obsessively on prevention, stress reduction, and harmony. A defibrillator relies entirely on man-made electricity to shock a failing body back from the edge of the abyss.
Right.
So here's the question. If our modern daily lifestyles incorporated far more of the preventative, stress-reducing, whole-person practices of CAM, if we all actually slept, managed our cortisol, and lived harmoniously, would we ultimately see far less need for the terrifying, dramatic chemical interventions of the crash cart?
That's a great point.
Or is the reverse true? Does the very existence of the crash cart's safety net, the absolute knowledge that if our heart stops, modern science has a 360-joule lightning bolt to catch us when we fall, is that technological safety net what actually gives us the profound peace of mind required to safely close our eyes, lower our defenses, and explore those slower holistic paths?
Oh, man. Does the safety net of the emergency room give us the psychological freedom to actually relax and meditate in the garden? That is an absolutely brilliant question to end on. Thank you all for pulling up a chair and exploring these wild extremes of human survival with us today.
It's been a great conversation.
Until next time, take care of your whole self and maybe memorize where the nearest emergency kit is, just in case. Thanks for joining us on this deep dive.